What is anxiety? Well, it's a normal emotion that we all feel at times, different from fear in the sense that fear is a reaction to being in danger right now. Anxiety has similar bodily sensations, but it's a false alarm. What causes anxiety? Well, it can be worsened or triggered by actual things happening in our environment. It can also be caused by different kinds of medical conditions, medications, or illicit drugs. Anxiety disorders run in families, but how you cope with anxiety is really up to you. Slow down to notice what is working, what they're doing right, and celebrate it before moving on to things that they're stressed about. Helping students develop some kind of structure will help reduce their anxiety with all the free time that they have. Of course, they need to stay on track with their college applications, the deadlines. When you ride public transportation, you may see a phrase like this, if you see something, say something. I think that applies to us as professionals too. If you're noticing something different about the student, whether it's a look on their face when you're meeting with them, or whether it's a pattern of behavior you've seen recently, try to understand what's going on. Hey, I've noticed this, what's up? And of course, you want to be a role model in terms of how you cope with stress and how you take care of yourself. College capable students, you might feel fairly confident that they're going to be okay in college, but are they ready for the independence? Independently seek out those services for whatever it is, whether it's the tutoring center for academics or the counseling center for mental health. Figure out how to keep going and get those services even if there's obstacles. What you can do about anxiety: meditative practices, exercise, sunlight, rest, music, connection with others. If you live with loved ones, you probably hug them on occasion, but how often have you leaned in for a full 30-second hug? You'll feel your heart rate starting to go down over that time. And of course, professional treatment, whether it's medications, traditional psychotherapy. So the majority of students said that the pandemic impacted their mental health. And yet, more than 2/3 of them did not seek professional help. And by professional, that includes going to your college counseling center. Because most people aren't seeking professional help, you've got to rely on all those other strategies that we talked about besides professional help. So how do you get professional help for folks? Students' primary care provider, their pediatrician, nurse, whoever their primary care provider is, the high school counselor, the health plan that students covered by the American Psychological Association has a locator on their website. With the college counseling center, you want to find out what's the counselor to student ratio, how many counselors do they have for all the students in the college? Is there a limit on how many sessions they can have per semester? If you've committed to a college and then you start doing the research, that's not the time you want to discover that. But go beyond the college counseling center, because the college counseling center frequently can't meet all college students' needs. Breathe to relax. All it does is teach you how to do deep breathing. So if you don't know how, or your students don't know how, get this free app, very simple, and it's a really easy way to learn how to do deep breathing. APA has lots of resources. The ADAA, Anxiety and Depression Association of America, also does. You can go to my website, topcollegeconsultants.com, and go to the media page or the blog.